I'm Leslie Elliott Boyce, and I'm speaking today with Andrew Hartz of the Open Therapy Institute. And this is going to be the first sub-bullet on our discussion around overlooked issues from mental health. And so today, Andrew, do you want to introduce the topic?
Well, I had just wrote an article for City Journal that came out about a week or two ago about victims of anti-white bias and aggression and how that impacts their mental health and what treatment for them might look like.
Right. So that is a real spicy topic for a lot of people. There sometimes we've even heard that saying there was a big, I guess, controversy in Olympia or Portland not that long ago where someone put stickers that said it's okay to be white around
Hmm.
in a public area, and this was seen as an act of overt racism. So
Right.
there are so many people who are ready to deny that there's even such a thing as racism against white people, and bringing a topic like that up could feel very controversial, yet it's something that a lot of people are experiencing.
Yeah, and I mean, I was taught that in my training that hatred and aggression of white people, no matter how vicious, is not racism.
Mm.
And I think that's actually, it's worth thinking about why that claim is so important to DEI activists and DEI officials. It's a very important it's very important to them
Mm.
that hatred and aggression directed at white people not be considered racism. And the only thing I can think is they want to diminish and invalidate people who face that sort of hatred, and they want to prevent them from receiving help. Uh, Maybe they also want to empower the attackers against them, that it's not as bad what they did.
Mhm.
But it's just when you really, I think it's worth thinking about that, why they're doing that for a second, because uh, it's hard to come up with explanations that aren't malicious.
Mhm.
Um,
Yeah.
but it's very, very important to them. And I think if you really think about it, it really starts to become scary, that that's such a core value of theirs.
It really is. It really, I have tried also to figure this out. Why would this be something that would be so heavily promoted by educational institutions? I mean, you can understand how individuals would end up with their own biases and their own resentments and fears or sets of beliefs, but for a school to actively promote or the entire field of mental health or the whole DEI enterprise really to promote this concept, it feels intentionally divisive. Is sort of the only way I can think of it. It's very harmful and
It's
it's very
yeah,
divisive.
and then hateful. I mean,
Mhm.
there's an aggression in it. I it's succeeded.
Mhm.
Well, it's succeeded in taking the voice away from the people who've experienced these things. It's succeeded in making victims feel invalidated and shutting them off from services, shutting them off from support. It's really succeeded in I think doing what it is intended to do.
Mhm. Mhm.
Uh, and I struggle. I Part of the reason why I wrote the article, and I was kind of curious about what criticisms I would get for saying we need to have mental health care for this population. And part of what I was curious about is, what are they going to say? I had no idea. I want to hear that people say this is a population that doesn't deserve mental health care,
Mhm.
or we
Mhm.
shouldn't write about this topic. We shouldn't educate people on this topic. We shouldn't have resources for this population.
Mhm.
Um, I wanted to hear them, and I wanted to hear why,
Mhm.
because I can't think of any reason for saying these, sometimes, I mean, we give mental health care to prisoners and sex offenders and terrorists, and all kinds of people that really have done bad things.
Mhm.
These are people who did nothing wrong, but be white and be victimized uh, with different forms of hatred. Um, why should they not be able to get services?
Mhm.
I,
It's
and
a yeah,
yeah,
it's a difficult thing to justify.
yes.
Mhm.
And so I'm think I'm calling their bluff. We'll see what happens, but I think we'll build these services, we'll do good therapeutic work.
Mhm.
I mean, just to be clear, I mean, I think all forms of race hate are wrong against anyone, and that anybody who experiences race hate, if they want mental health care, should be able to get attuned, competent mental health care.
Mhm. Mhm.
And um, I don't see how somebody could disagree with that. But
Mhm.
I'm curious. We'll see if they come up with anything or not.
Well, I can hazard guess. When I made my first video for YouTube, it was a short 8-minute video where I talked about some of the things that I was being taught in a counseling program. And one of the things that I brought up was this idea of broaching race, that you are to bring up race with your client in the first session. You're supposed to address their race
Right.
and your own, and then ask them about if there's any kind of difference. Like, say you're a person of color and I'm a white counselor, and I'm supposed to ask you, how does it feel to be sitting with a white counselor, and
Right.
elicit attitudes and opinions and beliefs around race. And if they're also white, I'm supposed to enter into a conversation with them around white privilege. And basically you're supposed to be getting people to see themselves as either victims who are marginalized or oppressors of other people, even if it's unwitting oppression that they've inflicted upon other people. And so the response that my school gave when I made that statement, when I put that video out, was that I was a white supremacist and I was centering whiteness and I was calling for therapy to center whiteness. And so this is interesting, but it was also coming from a school that had tried to put us into groups for white accountability and BIPOC
Right.
affinity. And so
Yeah.
there's a lack of rationality around this, which is really stunning for a lot of people because, there's so many experiences that are common to people across demographic categories, but you're telling a certain subset of people that they can't really have experienced something because of a demographic marker.
Yes. Well, and it goes, none of those interventions are evidence-based.
Mm-mm.
Um, and it is worth one thing that's also shocking to me about those interventions that you outlined, um, the people that advocate for them often seem totally uninterested in even pursuing evidence, even seeing whether or not imposing this script on therapy sessions improves the outcome. It's pretty common sense that it doesn't. I would bet, my bottom dollar that it makes it worse. But be curious enough to question whether or not it is true and maybe do some research before imposing it on everybody. Um, because that's the other side of what you're saying, which I think it's experienced again in lots of university programs, not just in mental health. But forcing people into a category, a bad racial category. I think that's a pretty central dynamic to a lot of these programs. Emphasize racial differences. Some of this happens with gender and other identity categories too, but just sticking with race. Emphasize these categories. You say only bad things about the white people, and then you praise and celebrate the others.
Mhm.
They're certain that you want to empower, validate, support. They're strong, righteous, beautiful, noble. They're enriching spaces. They're central. They're valuable. And then these other the white people are toxic, fragile, sinful, immoral, selfish narcissists who need to be dismantled. Um, it's all or nothing. And in my experience, I think in my entire training, I never heard a single positive comment about white people. And I don't think I heard a single sincere criticism of Black people. If there was anything
Mhm.
negative trend in that group, it was always attributable to white people's
Mhm.
racism.
Mhm.
And that schema, I think, that schema that just says only bad about white people and only good about the other races, that really is the dominant schema in a lot of universities, a lot of different programs, and it's the vehicle for the hatred.
Mhm.
You can't just divide people into groups and say only bad things about one and only good things about the other. It's not true. It's not an accurate picture of these groups, but it's very aggressive and it's really dysregulating to people. Um, and I think that people have a hard time, maybe in particular white people have a hard time uh, standing up for themselves on the issue or getting their bearings with it.
Mhm.
I had a lovely conversation last night with a student at Columbia who was Jewish, and she was talking. She said, her life is better now than it was on October 6th
Mm.
because the Jewish community came together and supported each other.
Mm.
And there's more a sense of cohesion and support now than there's been in her lifetime. This is what she's saying. And I was talking about this stuff, and she's like, other groups can learn things from how the Jewish community responded to this.
Mm.
There are lessons to be learned about how you can come together in the face of hateful schemas and aggression to support each other. Don't become hateful yourself. Don't be aggressive yourself. Don't react in kind. I don't think that is effective or makes people feel good. But you can have some self-respect. You can support other people. You can constructively address problems in a positive way.
Mhm.
And but on this issue, people seem to really be struggling to find the right way to do it.
Mhm.
Um, I don't think thinking about what therapy would be like for somebody who's experienced this, and I think a ton have, anger about one's experience is a normal reaction, and I would expect it to be part of the stages of grief of responding to this as it is for most things. Um, but it's really not where you want to live your life. And it's not going to be good for your mental health, and it's not going to make you effective or constructive in any way. But I think a lot of times people do need a space where they can talk through the range of feelings. A lot of it's fear. A lot of it is like humiliation. A lot of these trainings are incredibly degrading and humiliating and disempowering. Um, So people are going to have a wide range of feelings about it that they process. And I think some processing is needed for people to get their bearings enough to be able to talk about it. Otherwise, there's too much. And then I think they get derailed by the intensity of the affect of like having such painful experiences and then never talking about them. And then they start talking and it's like, it
Mhm.
doesn't go where they wanted it to.
Yeah, absolutely. And I think that that need to process it and that experience of anger and humiliation and unfairness that comes up for a lot of people who've experienced this, if they think that they can turn to a mental health professional to help work through this, and then they're met with more of that same ideology, which gaslights them and tells them that what they're experiencing isn't real or that they're wrong for feeling it, then it can compound that difficulty. And I've talked with a lot of people who've had exactly that experience.
Oh, they tried to talk about it with their therapist and it
Hmm. Hmm.
yeah, yeah. I mean, I would expect it because a lot of therapists, this is what their training is.
Hmm.
And yeah, that's why they need to have different services.
Hmm.
They need to have actually people who specialize in this, where they can actually go and find a therapist who cares about this issue and can respond in
Hmm.
a clinically competent way. Because I think your average therapist is sadly not necessarily going to get it or be able to help in any meaningful way.
Hmm. Hmm. Yeah, and this is something that this kind of training, that this false dichotomy between white people bad and other people good, or white people oppressor and other people oppressed, it's so problematic in so many ways. It's a rhetorical fallacy, for one, that we even have these these groups, that these groups are even distinct in this way. It sets up a
Right.
white and non-white when we have so much more complexity to our ethnic and racial makeup. But also it equates even positive behaviors that are associated with whiteness for the purposes of this ideology with something bad, and sends the message to all people, white
Right.
and otherwise, that these things are to be avoided and shunned. And there are things like self-regulation and showing up on time, and these
Right.
things that are equated with success end up being falsely equated with white racial makeup. And so this sets up a difficult problem for everybody involved. It's not helpful in any way.
Well, it's, as you know, it's splitting.
Mhm.
They're splitting, and that's basically forcing the all or nothing framing of these groups, and an inability to tolerate that any group, no matter how you think about it, is going to have a combination of positive and negative trends and dynamics. That ability to tolerate that is called ambivalence. And ambivalence is really central to maturity and functioning institutions and mental health. And when people split a lot, it gives them personality disorders.
Mhm.
And it gives, it's seen as really central to borderline personality disorder in particular. And I think this is the number one reason why we're seeing kind of a borderline quality to institutions, extreme fragility, aggression, severe distortions of reality, unstable relationships, unstable grasp on reality, constant conflict. These are the types of things that you expect to happen when splitting gets really entrenched at an institution. And the place where splitting is probably talked about the most is on inpatient psychiatric units.
Mm.
And the standard, if I can digress, and I'll tell the standard story of how splitting happens on a psychiatric inpatient unit, is you have a patient who's controversial. Let's say this person has borderline personality. She has borderline personality disorder, and she wants extra time in the art room. So she says, and let's also say she's somebody who self-harms. She
Okay.
cuts. And she says, if I get extra time in the art room, I'll self-harm less.
Mm.
Some of the staff will like this patient and she'll like them and they'll become advocates for her. She might even be a little bit charming and charismatic with them. And they'll say, listen, art is a coping skill. Let's give her extra time in the art room. That'll help her practice this coping skill. It'll reduce cutting. Let's help her do this.
Mhm.
Another group of staff she might not like, and they don't like her necessarily. Maybe there's more conflict there, and they take a harder line and they say, no, she's using the threat of cutting to get a privilege that the other patients don't get. If we give her time in the art room, we're reinforcing that she can threaten to cut to get what she wants. We need to keep a hard line here and not let her do this. And then when you're on rounds, when you're in the inpatient unit and the staff is there, they divide up into these groups and they start fighting.
Wow.
And the head of the unit, the head attending, really has to say, hold on, this is a borderline patient. We're starting to split. We have to tolerate the ambivalence that this is a complicated situation. And we need to come up with a policy that's fair for all the patients and trying to get people away from the enactment. But as soon as you start framing groups of people in all or nothing terms or issues in all or nothing terms or whatever it is, it starts to spiral and the conflict escalates, the emotion dysregulation escalates. And if they don't call it out and confront it, the unit will go crazy. And it won't just be the staff. All the patients are going to get dysregulated and you're going to get fights and you're going to get all kinds of stuff that's going to happen because it's such a dysregulating framing when people start splitting. If the head attending says, these people are right, how dare you do that, and gets sucked in, the unit is going to fall apart. So that's a long digression, but just to kind of explain, like, if you're at a university or a program where they're doing the same thing, where you have people framing groups of people in opposite all or nothing terms, you're going to get conflict. You're going to get emotion dysregulation. You're going to get spiraling aggression. And not all of it is even going to just be about that issue. You're going to get more mental illness. You're going to get more anxiety. You're going to get more distress. It is so crazy making.
Mm.
And but there's nobody in charge who's saying, hold on, every group has positive and negative trends and dynamics in their culture and history. Our discourse needs to reflect that. We have to have the capacity for ambivalence here. Nobody's doing that. And it's just spread it to a national level craziness. And I think it's not my take is it's not primarily a Democrat Republican splitting thing. There is some of that. I think it's primarily around the identity politics stuff. This is the thing that my opinion is driving the insanity.
Wow, that is extraordinarily fascinating, because the framework that you're offering, that observation, demonstrates how it's the very process itself that becomes contagious. So you have it starting with this individual and spreading outward, and then it gets uptaken by the groups around the individual. And so I've wondered about this. I've wondered, how can the professors who with one breath can teach me about these complex psychological processes and modalities and just this depth of perception and understanding of human nature, they can express it over here. But then when we turn and we talk about race, or we talk about gender, these social justice topics, they have this very reductive frame of mind. And I've wondered, how is it possible that they can't see what they're doing? And so you're describing a situation in this inpatient scenario that you offered, where the people who should see this themselves become captive to it and start to enact it. And so that's really, really interesting.
Yeah, and I think there's something about really intense splitting, even if you're just thinking about therapy, individual therapy with a patient who has borderline personality disorder. Getting pulled into enactments and getting pulled into splitting is very common, because they're framing everything as in all or nothing terms. And it's very easy as a therapist to join and kind of get sucked into their worldview. And you're the idealized therapist, and you're the only one who gets it, and they think you're the best ever, and you get them, and you're on, and it's so easy to go there, or to go the other way and be like, this person drives me crazy, no wonder everybody hates them, and to kind of get sucked into that. And it's the challenge of the work is to keep that ambivalence, where you can kind of see what's charming about and endearing about this person, and see where things are going wrong, and to really, it requires a lot of effort and work to hold on to the ambivalence. But it really becomes the medicine. The ambivalence really is the medicine. You hold on to that point as the therapist and keep reflecting that back, in your nonverbal, in your framing, in what you say with them. And they're getting the medicine that really treats they're really applying that, and it decreases the inflammation, it decreases the irritation, it increases the sobriety and emotion regulation. It's like, that's the heart of the work. And on the racial stuff, there's nobody doing that. It's just, we're struggling to do it. And a big part, not to jump around too much, but a big part of it is that people, I think, get sucked into side issues. They're afraid to talk candidly and directly about the main thing that's happening here. Because they're nervous about it. So they kind of switch to something about, in a way, it's about I think the arguments about viewpoint diversity are kind of about anti-white hate. But it's a more palatable way to kind of say, maybe we need another view on this issue. Or there's this, I don't know, different ideas about unity or something. People really try to talk around it. And I think that that's ultimately not going to be successful. I think we have to actually have the courage to be candid and direct about, I think, a central dynamic of these programs and of our broader society. And do that while holding on to that ambivalence and doing it in a mature way.
And when you talk about ambivalence being the medicine, and you're describing this process by which people hold on to these illogical ideas or have presented them and what's wrong with them, and how you're giving some psychoeducation around splitting, I imagine that this would really, hearing this from someone would be a real balm for a person who's been going through bullying around these issues. Hearing
Yes.
this explained in a, well, here's something about human nature and human dynamics, and what you're experiencing is really this. And you can talk about how that's impacted you. We can talk about what impact that's had on you, and you can come to kind of understand it in a new way. And through that nuanced discussion, I think that would be a real just source of comfort and relief for someone who's been struggling with conflicting ideas and guilt and shame and embarrassment and anger around what they've
Yeah,
experienced.
totally. And the thing to kind of go back to what you're saying about your professors, and I've seen this too,
Mm-hmm.
they can't emotionally tolerate a conversation that talks about positive and negative trends and dynamics in every group.
Mm.
They cannot tolerate ambivalence on the identity politics issues. That's the central thing. So they need at an emotional level to rationalize why white people never deserve empathy, why hatred against them never matters, why they have no cultural value or strengths, why they don't deserve, they need to rationalize this. They need to rationalize why no other groups have weaknesses. If they have a shortcoming, it's just white people's fault. They need to, this is at an emotional level. It's unbearable for them to hear that groups have positive and negative trends and dynamics. Unbearable.
Mm.
That's why if you say something, I think this is part of why people are nervous about it. If you say something, they'll go ballistic in a way that is, I think,
Mm-hmm.
very
Mm-hmm.
clearly kind of infantile and unhinged. Crying, screaming, threats of violence, just a total mental breakdown. They cannot tolerate the obvious truth that all groups have positive and negative trends and dynamics. If you want to think in terms of groups and talk in terms of groups, they all have positive and negative trends and dynamics.
Mm-hmm.
And that's just unbearable to them. And that's just the hallmark of the borderline dynamic of the splitting that's being really entrenched in our society.
Yeah, you're not exaggerating. This happened to me in a class where a teacher broke down crying because I questioned some of the teaching on race. It
Right.
really did cry in front of the whole class about her emotional labor and how it wasn't a safe space. And this was also a teacher who, with blonde hair and blue eyes and pale skin, didn't identify herself as white. She was Hispanic or some other Latinx or
Right,
something. But
right, right.
it was anything to distance yourself from that hated category.
Right. It is important because there are people who are white who share that same splitting happens in all kinds of ways that might be unexpected. I mean, one place where splitting happens a lot is depression.
Mm.
And depressed patients sometimes have almost like this deep need to frame themselves and the world and their future and everything around them as negative and hopeless. And if you try to suggest that it's not that all or nothing, it's intolerable. They have a very hard time tolerating it. Now, that reality same as everything else. That's the medicine. That's the ambivalence. That's the medicine. It's not telling them to be positive about everything all the time. It's telling them to have the capacity for ambivalence. Notice the strengths, notice the hope, notice there is positivity. That's part of it. Even if it's a small part of it, it's a piece of it. But what that shows about splitting and what it shows about ambivalence is that in the short term, it's easier to feel depressed than to feel ambivalence. It's easier to hate yourself than to tolerate ambivalence. And that's, I think, might be part of why people are so puzzled as to why this framework that demonizes white people and idealizes other races, why is that so appealing to so many white people? And it's because ambivalence is hard. It's not an easy thing, and there are times when it's easier to hate yourself than to tolerate ambivalence.
Well, it really does seem to be epidemic right now, the splitting
Yeah,
and the difficulty with ambivalence, especially around identity politics. And I think that it's a really important thing to bring up, the impacts of anti-white
but
racism.
let me say one thing before we
Mhm.
wrap up here
Mhm.
about this, which is the splitting framework is just kind of one theoretical tool
Mhm.
to articulate what's happening here.
Mhm.
And I think with victims of anti-white aggression and bias, there are lots of other tools out there that are really impactful. And a lot of times as a therapist, you need multiple tools. One tool is usually not enough to get through a therapy. So I think one thing we really want to do is highlight all the different tools that are helpful for this population. And hopefully we'll start doing that work.
Yeah. Well, thank you so much, Andrew. It's been a really interesting conversation, and I hope people get a lot out of it.
Thanks, Leslie.